We're back now to continue our conversation about anxiety. It's a topic a lot of you probably can relate to, especially during the pandemic. Dr. Tyler Fortman is my guest. He's a licensed clinical psychologist and is the CEO of an outpatient medical practice here in Chicago. Thanks so much for joining me tonight.
Yeah, thank you for having me.
So tell me a little bit about what you're seeing with your patients in terms of anxiety. Are you getting the sense that we are in a national anxiety crisis?
Absolutely. Yeah. Both in our practice and then across the city and across the nation, there seems to be much more need than there is capacity to provide help, and which is a great indicator that we are in an anxiety crisis. We're seeing sort of like a lot of fear of infection, but then also other related problems. And so we're seeing people come to us with lots of isolation and loneliness, relationship problems.
Do you feel like the pandemic has played a very critical role in elevating the amount of anxiety you're seeing from a clinical standpoint? Because a lot of people were suffering with anxiety before the pandemic, right? It's natural that we're in this. It's probably getting a lot worse for people. But from your standpoint, are you seeing more patients because of the pandemic, or it's just already made their problems worse?
We're both. I think my answer is both and. Yes, we were seeing a rise in anxiety, and we have been seeing a rise of anxiety for some years now. But the pandemic did sort of exacerbate the problems that exist there.
I think a lot of people feel anxiety at times in their lives when it's natural, right? Like you're going for a job interview for a new job. It's natural to feel anxious for something like that. But how do you know when it's getting so serious that it's time to seek out a therapist or get some medication?
Yeah, absolutely. It's a great question. I'm glad you point us in that direction for the topic, because you're right. Anxiety does exist on the spectrum, and some anxiety is normal. And in some ways, it can even be healthy to have some anxiety. That anxiety you feel before a job interview might encourage you to prepare for the job interview. It might keep you a little bit more on your toes, for example. And that's not bad. That's actually good. But then there's a threshold in which the anxiety becomes excessive. And when we think about it being excessive, what we're really looking at is, when does functioning start to become impaired? And that's the point at which seeking additional help is important. And so when I say functioning being impaired, that's a pretty broad kind of statement. But that could mean physical health, like things like I'm having problems sleeping, or my heart just seems to be racing all the time and I can't really seem to get it to slow down. Or it could be in a different domain of functioning, like that someone might have lots of anxiety that gets in the way of their work, and so they're just not able to function as well at work that they have been in the past.
Yeah, I love how you put that about it impairing your function, and I think a lot of times when that starts to happen in somebody's lives, they end up kind of falling into a deeper depression. So help us understand a little bit between that link of depression and anxiety. They often go hand in hand. How do we navigate that?
Yeah, you're right. They do often go hand in hand. And you're alluding to something that is part of the reason for that, which is that there are some similar symptoms in both conditions. And so a result of that is that there's just some diagnostic overlap. Mm-hmm. But in addition to that, there are environmental factors that cause people to experience both at the same time. And so the pandemic is a great example of that. It's a condition, it's a situation that people are facing that is causing them, that might lead to isolation, it might lead to work burnout, it might lead to less of the goodness or the meaning in their life. And that can lead to both anxiety and depression, right? They're also both very heritable. And so there's this kind of genetic risk of having both. And because both are so easily inherited, some of the highest heritability coefficients we see among any mental health disorder, that it's more likely that a person would actually have both conditions than it might be if they weren't as heritable.
I feel like because we are having all of these conversations, and certainly mental health has come to the forefront during the pandemic, it is helping break that stigma a little bit that we are all hurting. But for you, what would be the advice that you would give to people about taking that first step to get help?
Hmm. Yeah, really, I give people the advice to take a look at what would be most helpful to you right now, and to really consider some compassion for yourself and ask you, well, what would that take, right? And so that can be different for different people. If it's therapist, if it is medication, then what's the easiest access point for you? Maybe there's a place that you walk by and you see the clinic's sign on the street, and you've walked by it day after day, and it would be just as easy to pop in the door. Then if that's the low-hanging fruit, that's a great place to go. If that's not it, and you want to make sure that you find something specific, use the internet. It's available to you. Every practice, maybe not every practice, but certainly most practices in this country have some kind of internet presence. You can find a therapist there. Interview people, talk to people, determine if the fit is right.
Dr. Fortman, thank you so much for your time and your insight. We really appreciate it.
Thank you so much.